Hello, my name is Monique Perez, and today I'll be talking about the benefits of universal healthcare. Universal healthcare is the idea that everyone within a country should have access to medical services without fear of cost. In the developed world, the United States is the only country which does not provide a complete universal healthcare access system. Some people do qualify for Medicare or Medicaid because of their age, household income, or personal circumstances and experience a different type of universal care, but not everyone qualifies at all times for this type of medical access. So today I'll be going over some of the benefits of switching over to universal healthcare. So the first benefit is that it would lower the cost of healthcare for the economy. When a system of universal healthcare is in place, the government is able to leverage the size of the medical market to negotiate better pricing structures. That lowers the cost of care because services and medications tend to be lower. Although doctors and pharmaceutical agencies may receive less compensation per service or item, healthcare spending as a portion of the GDP goes down. Next, it would reduce administrative costs for care access. Within a private pay system, health insurers have administrative costs which are built into the expenditures required of patients for care access. Medical practitioners have higher administrative costs as well. When a universal system of healthcare is in place, the administrative requirements become simplified. Instead of dealing with multiple agencies, there's only one agency to bill. It would also simplify the rules process. In the United States, an insurance company may stipulate that they approve of services before they are given to a patient. That means if a doctor thinks an MRI may be needed to diagnose a medical issue, the insurance company must first approve of the service. If the MRI is given without their consent, then they may be able to place the cost of the service on the patient, even if the service is covered under the insurance policy. It would also remove the medical competition. The U.S. healthcare system targets the wealthy. The system of care offers services that are expensive, which allows them to pay doctors more. They funnel money into research and development to create new services to offer, then price it outside of the spectrum of the average person. The goal for any for-profit business is to make money. If healthcare is put into a for-profit system, then patient care focuses more on those who can pay and less on those who cannot. If we had universal healthcare, there would be no competition to drive prices higher for patients. And without competition, care is less of a business practice, which would improve quality metrics. It would also create a healthier workforce. In the United States, 46% of patients went to the emergency room for medical services because that was the only place they could afford to go to before the Affordable Care Act was implemented. That is because an emergency room is obligated by law to care for people, whether they can afford to pay or not. With universal health care, there's a greater emphasis placed on preventative care. When people can be proactive about their health, the need for emergency interventions decreases. Right now, about 20% of Americans reported being unable to afford insurance. So, with universal care, there would be prevention paired with care, which would mean fewer people would miss work for medical reasons as well. The World Health Organization said that a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity, is one of the fundamental rights of every human being. So, switching over to universal healthcare supports the idea that healthcare is a basic human right, which is a controversial topic that's widely discussed. It would give equal care to citizens without being detrimental to them mentally or financially. It is good that we have laws like EMTALA, though, that allows everyone to be treated. Having universal health care for everyone could do a lot of good, especially for the kids, who are unaware to the fact that they need it and usually can't see a doctor without some type of plan. They will be able to see a doctor and dentist for checkups on a regular basis. They would also be able to stay up to date with their shots and immunizations, creating a healthier environment for the classrooms and communities. And without large, unexpected bills or the guilt of not being able to take your child to the doctors when they need it, it would just help for a more positive and stress free family life, setting the children up for a more successful future. And having universal care would obviously improve the access to care for everyone. In order to achieve this goal in strengthening a community's health and economy, universal health care coverage will help inform and encourage people to stay healthy and prevent illness. It will also help reduce social inequities and poverty by detecting community health conditions earlier. The whole point of universal healthcare is to provide healthcare services that are affordable, available, and must have a large capacity of well trained health workers to provide the care. It would also almost promote more effective treatment. Only 70% of Americans believe that they will get the most effective care possible if policies were to be changed to the universal healthcare system. Norway and Sweden are already using the system and are confident in the community's positive response to the new change, and the quality of care they are receiving has not decreased. Immunization shots would be more common because they would be offered for free for everyone and would eliminate the excuse to not get one. There would be more community health promotions, which are usually directed at national obesity, smoking, etc., and screening tests such as mammography, which would be available to all women, being able to catch breast cancer victims earlier. These are the references that I used to help create my presentation. Thank you for listening.